A very good evening. You're watching CVR English with me, Ambika. So today we are telling about the hair fall problem. So today we have our Dr. Shruti, a managing director and a consultant in a Science of Skin clinic. So as we observe in our day-to-day life, we observe a hair fall, a common problem in men and women. So today we'll check about the hair fall with our doctor. So yeah, hi Shruti.
Hello.
So what exactly a hair fall is?
So the normal hair fall can be defined when we know exactly how the normal hair grows. So the normal hair grows according to a cycle. The first stage in the cycle is called the anagen phase, where it grows for about 2 years to 6 years, and in this stage the hair is only in the growth phase, after which it enters into a telogen phase where there is complete resting, and it can rest for up to 3 months, and after this it goes into a shedding phase. So this is the normal growth cycle of the hair, and in this growth cycle we can lose up to 100 hair per day. Now any alteration of this cycle and the increase in the number of hair lost is when we say that it is problematic hair fall.
So what could be the causes of hair fall?
So there are many causes that can lead to this big problem of hair fall, and the most common factor is genetic. Apart from that, there are various lifestyle factors also that we ourselves cause upon ourselves. So the various factors would be exposure to pollution, not taking a proper diet, stressful conditions, any change in place or change in water. Apart from that, there can be medical reasons as well. If you're suffering from any illness, if you're having an underactive thyroid or an overactive thyroid, any viral infections that you could have come under contact with. So there are a number of reasons why hair fall can be caused, and the problem with hair fall is that for whatever reason the hair fall does come up, it is a progressive condition. Once it starts, it does tend to lead to some amount of balding.
Yeah. So how does the hair loss in males and females?
In males and females it does differ because of various factors. In males, about 85% of males tend to go bald by the time they reach 50 years, and that is a very common statistic. Apart from that, we are seeing males starting to lose hair or starting to get into a male pattern balding from 21 years onwards. So in males, basically what happens is the hair on the top of the head goes first, and there is a ring of hair in a horseshoe shape that is left on the scalp. In females, this is something where the front of the scalp retains its hair even if there is significant hair fall, and the top again there is devoid of hair.
So how do we get back the hair which is lost?
So hair that is lost due to male pattern balding or female pattern balding is not going to come back on its own. You will require some medication or some treatment for this. So the medication what is available, it is called minoxidil. It is an FDA approved medication to treat hair fall in males or females. But what happens with this medication is that it will work as long as you are using it. Once you stop, the hair fall can come back. So there are treatment options for this. There are surgical options and there are non-surgical options for this.
So what is the PRP treatment for the hair loss?
So the non-surgical treatment what is available is called PRP treatment. It is called platelet-rich plasma. So in this treatment, what we are basically doing is that we're using platelets. Platelets are nothing but normal cells in our body. So these platelets are, the basic function is to stop bleeding. When we get a cut or any trauma, they just help to stop bleeding. One more advantage of these platelets is that they have growth factors, which we use in hair fall treatment. So we just take the growth factors from the platelets and inject it into your hair follicles, and this, it will decrease the hair fall as such.
So how is this PRP treatment done?
So PRP is done in a way where we draw around 20 ml of blood, just like how you would give at a normal blood test, at a routine blood test. And once we take your blood, we centrifuge it along with a double spin method, and this gives us a certain number of platelets. Now these platelets, we again divide them into platelet-rich plasma and platelet-poor plasma. The platelet-poor plasma is discarded and we inject the platelet-rich plasma.
So who can get done this PRP treatment?
For that, to find out if PRP is beneficial for you, it depends on the type of balding that you're in, and for that you'll have to visit a dermatologist and undergo a consultation.
So are there any side effects to this PRP treatment?
So PRP is something where we are taking your own blood, your own growth factors, and we're injecting it into your scalp. We are not adding anything extra into it. There is nothing foreign going into it. So there are minimal to none side effects, and even long-term side effects are nil with this. But it is a proven technique to regrow your hair in a very natural process.
So these days we got to hear about the hair transplant. So what is this hair transplant?
So as I explained, in hair fall treatment there are surgical options as well, and that is where hair transplant comes in. Now you may be at a degree of balding where only PRP may not be enough to give you back your entire hair. So that is when we do hair transplant. Hair transplant is a surgical procedure, and it is done in various grades of balding. So the way that this is done is that we use two different techniques. One is an FUE technique, which is a follicular unit extraction, and one is called follicular unit transplant. So there are two different techniques in the way that this is done. Now the reason why hair transplant is done, and the reason why you would lose hair, is because there is a hormone on the hair called testosterone. This is getting converted to a form called DHT, dihydrotestosterone. So this DHT, it attacks the hair follicles and it attaches onto a receptor site on the hair follicles. This receptor site is absent in the hair on the back of the scalp, but it is present on the top of the scalp. So when we're doing a transplant, we are basically taking your hair follicles, your hair grafts from the back of the scalp and transplanting them into your bald areas. Because the DHT effect is not there on those grafts, once we put in that hair in a transplant, that will not fall lifelong if it is taken care of. So it is a permanent thing, but your existing hair can still fall, so you will require medication or PRP treatment to take care of the existing hair.
So how is this hair transplant helpful in male pattern baldness?
So in the two ways that it's done, either in FUE or FUT. So in FUT, basically what is done is, there is a thin strip of hair that is taken from the back of your scalp, and the hair is separated from that strip and it's transplanted into your bald areas. So this is something where you will require a suture. There will be a visible scar present. But again, this is an outdated technique. It's not commonly done. What is more commonly done now is the FUE technique, which is also known as a scarless technique or a sutureless technique. So for this, we use a motorized sponge and we remove the grafts one by one from the back of the scalp, and then we transplant them into your balding areas. So with this, there is minimal pain and minimal side effects and no scar.
So how many hair grafts will I require?
That depends on various factors. One factor is the amount or the degree of balding. So, and apart from that, your frontal line, that is a subjective thing, the frontal line. So you can decide how you want your frontal line. We would draw it for you prior to the surgery so you can have a better idea. And apart from that, the density or the fullness of the hair. Now in the density of the hair, again there are two variables in this. One is a fuller density, where we would put around 42 follicular units per square centimeter, and there is a camouflage density, where we would just cover the balding and around 22 follicular units per square centimeter would be transplanted. So in a fuller density, you would look like you have a head full of hair with nice thickness, nice volume. In a camouflage density, only the bald areas would get covered.
So how is hair transplant done?
So hair transplant, again, it is done by the FUE and the FUT technique, which I had explained.
Okay, so what are the different ways of doing this treatment?
So there are many different ways. Apart from the ways that I've already explained, there's something called a robotic hair transplant, and along with that, people are using autocloning techniques or stem cell techniques into this. But those more studies are still required for that. But the proven method right now, which is working and giving very natural results, is the FUE or the FUT transplant.
So when do the results come for the treatment?
There are different phases in hair growth. First, there is a growth phase. In this growth phase, we see that the hair is growing about 12 centimeters over about 4 weeks. And what happens after this is that it enters into a temporary shedding phase. Whatever hair we have transplanted will slowly start to shed over the next 3 months. And this is the phase where most people get worried. They feel that all the hair that has been transplanted is shedding out. But this is this is a normal process, and we just have to be patient at this time. And after that comes the permanent growth phase, where whatever hair has fallen out starts to regrow. And once it starts to regrow, it takes 9 months to 12 months for the entire growth to be seen.
So what happens to the extracted area? Does hair grow back again?
The extracted area is going to look completely normal, like how it was before you even had a transplant done. If you do the FUE technique, since it is a completely scarless thing, the donor area is going to be it's going to look completely blend into your existing hair. So wherever we have removed the hair grafts, in that area the hair will not regrow. But the way that the technique is done is that we take grafts in the surrounding areas so that the surrounding hair grows and it covers the donor area completely.
So when do we get results for this?
Again, the first 3 months is a little crucial, because that's when the hair starts growing, and it completely sheds over the next 3 months, and from the 4th month onwards is when the permanent growth starts. So you will have to be patient and at least give it 9 months to 12 months to see the end result.
So what is the cost of this hair transplant?
The cost again has many variables. It depends on what technique is recommended for you, whether it's the FUE or the FUT. It depends on the degree of balding what you're having, and so for that you'll have to visit in person, have a consultation with the dermatologist, learn exactly why you are having hair fall and what is the best recommended treatment for you.
So is there any side effects? If yes, what are the side effects?
So you can face a few side effects, such as maybe mild itching post the surgery or mild swelling coming up maybe on the forehead, towards the nose or the eyes, and all of these are perfectly normal. They usually just last a few days and disappear. This technique is done under local anesthesia, so you would be completely awake throughout the procedure, and it's completely painless. You may feel some discomfort when the local anesthesia is being administered, but apart from that there are minimal short-term or long-term side effects for this.
So do I need to shave my head?
Yes, to get the maximum amount of grafts from the given donor area, a male would definitely, we would trim the entire scalp. For a female, we would take a small window of hair and transplant the hair into the balding areas.
Okay. So do I need to take any rest?
After the transplant, you can go to work even the next day. Rest is not required. There is going to be around 5 days of medication that you'll have to take for this, and the donor area where we've removed the grafts will have a bandage for 24 hours, which will be just removed the next day, and you just do use the precautions what are explained, the aftercare what is explained, use the medication. Many people do go back to work the next day itself.
So do I need to wear a cap?
That is completely up to you. You can, but it's not mandatory. Just to keep out any dust if you are returning to work, then wearing a hat is always a good option, but it should be a very loose one.
So after this, do I need to take any medications?
The dermatologist would prescribe you some medication, some basic antibiotics, some anti-inflammatories post the surgery, and those would be taken for about 5 days. Now, along with that, you'll have to maintain your existing hair, so some medication is going to be required to maintain the hair so it doesn't fall. For that, we will be putting you onto DHT blockers, and these are very safe to take for the time duration that has been told to you by your dermatologist, and in the dosage what has been recommended for you.
So yeah, so we are done with this, and thank you for sharing your valuable knowledge to us. So what suggestions would you give to our viewers?
I would say do not ignore hair fall. Try to treat it at the earliest, because once it reaches a certain point and you are not ready to go for a surgical procedure, then surgery might be the only option. If you would want to treat it with a non-surgical procedure just with medication, do consult your dermatologist. Don't ignore it and just treat it at the earliest, and take care of your health.
So yeah, that's all for now. So we thank Dr. Shruti, the Managing Director and a consultant dermatologist in Science of Skin Cleaning. So until next edition, we would come up with a new specialist. So until then, bye-bye.